The differences between an LPN and an RN are not very cut and dry. In a lot of places, North Carolina included, my home state, there are state restrictions as to what an LPN can do and what an RN can do. And then there's also, we'll call them company restrictions, whereas a company's policy will say an LPN cannot do this, but an RN can do this, so on and so forth. So let's start with the initial difference between an RN and an LPN. And for argument's sake, I'm just going to call it RN instead of ADN or BSN. School. You go to school for 1 year of nursing school for a BSN, for LPN. For LPN, you go to 1 year. For a RN, you either go 2 for an ADN, 3 for a diploma nurse, which may or may not be in your state, or 4 for a BSN. Now, in North Carolina, we have diploma nurses. It's something that we have. Not all states have them. So the ADN, diploma nurse, and BSN are all RNs, and for argument's sake, I'm just going to use the term RN as to going through all three. So let's start with school, 1 year or 2 to 4 years, depending on what you want to be, LPN or RN. Once you start working, you're going to realize that the LPNs, the restrictions, there's more of them. You have more restrictions as an LPN as to what you can do, what you can't do, or who's going to hire you. Hospitals in my area do have LPNs, yes. In other areas, LPNs have been eradicated. They've been eliminated from the hospitals, and that's more or less like a company procedure, a company policy, that they want only RNs. In North Carolina, you can practice as an LPN at a hospital. You can practice in any company or any sector that an RN can practice in as an LPN. That is true, yes. But the company has to hire you. And I can think of probably 5 hospitals that will hire, and then probably another 5 that just won't hire anymore. It's just what happens. So the job market is definitely better for the RNs. Another thing, RNs are not allowed to work under an LPN, I'll say, meaning that an LPN in North Carolina is not supposed to be a charge nurse. I've seen charge nurses be LPNs. I've been a charge nurse as an LPN before. As an LPN, I have been a charge nurse. We didn't file the paperwork that way. We didn't file the paperwork that I was the charge nurse, but I did everything that the charge nurse does, and the RN signed off for it. So it's kind of under the table charge nurse. The RN has to be the charge nurse. That is a state rule here in North Carolina. They are also the managers. You may have an LPN that is a manager, but not necessarily a nursing manager. Maybe a manager of staff or something like that. But the RN is always on top, and then the LPN is never charged. Well, it's supposed to be never charged. There's medication restrictions also. Your normal med-surg meds can be given by LPNs, by any LPN. But where you start running into trouble, right off the top of my head, oncology medications. Patients that are oncology typically have something right around their heart. A lot of times it's on their chest, called a portacath. Basically, it's a little box that's kind of under the skin that has like an IV that goes into your heart, into your bloodstream. And the skin is over it. And like I said, it's a little box, and you kind of, there's a hooked IV that you use to poke into it. And an LPN, who probably knows full well and good how to do it, cannot access that portacath, cannot run meds through that portacath. You can do like care to the portacath, but you can't access the portacath, or you can't run meds through the portacath. You can do IV meds, but something about it being that little box, that little portacath, you're no longer allowed to do it if you're LPN. There are cardiac meds that need certain They need monitoring, constant monitoring. Amiodarone, amlodipine, it's the same thing. You know, that's one that I can think of. I don't know if that's exactly an RN only medication, but there are RN only cardiac medications that have to be monitored by an RN. Another one is initial assessments. LPNs are not allowed to do initial assessments, meaning that if you get an intake patient, the LPN can't be the first person to see that patient. An RN sees them. Now, after that, the LPN can do every single assessment until, you know, the end of their stay or whatever it may be. But the initial assessment has to be done by the RN. Medication, I'm trying to think of other things. It's kind of a fine line here in North Carolina. I know it's more defined, I think in Texas, where they're actually LVNs, licensed vocational nurses, and RNs. I think it's more defined out in Texas than it is here in North Carolina. It's kind of a gray area here as to what an LPN can do and an RN can't do. But the biggest factor here is who will hire you. Who's going to hire me as an LPN as opposed to me being an RN? You know, if your end goal is to work oncology, forget it here. You're not going to be an LPN in oncology. It's just not going to happen. Pediatrics is a little touch and go. I've seen LPNs in pediatrics, but you probably be better off getting the RN. Med-surg, LPN's just fine. Long-term care, LPN's just fine. Doctor's office, LPN. Nearly any clinic, an LPN is just fine. But the specialty clinics are probably going to be where you have to have that RN degree. The differences here aren't very big, but they're big enough to kind of keep you out of jobs, if that makes sense. So basically it's just the schooling, the assessments, and the meds that you can and cannot pass. And always check your board. The state board will give you an actual list, like parameters. The state board will give you a list of LPNs cannot do this, RNs can do this. So I hope that helps. If you have any questions, let me know. Thank you much.